Thank you, Acting President. I rise to commend the reforms delivered by the Andrews and now Allan government on the public drunkenness laws and penalties and the strides the Allan Labor government makes to ensure, and in doing so speak to the motion tabled by my colleague opposite, Ms Crozier. This motion asks the House to express its concern that the Summary Offences Amendment, Decriminalisation of Public Drunkenness Act 2021, will increase the risk to members of Victoria Police, people in a vulnerable state and the community. What an absurd comment. While those opposite had Victoria Police campaigning against them during Jeff Kennett in 1999, we have continually backed our police. We've delivered record funding to the Victoria Police. Our police force knows that we support them each day to do their jobs. Victoria Police has been closely consulted throughout the development of these important reforms because we know that listening to the community is the way to achieve the best reforms. We know the success of the reforms rely on the engagement of all stakeholders, and VicPol are a critical part of this. The Victorian community can be assured that our police force will remain and is able to respond to public intoxication in a decriminalised environment. And Acting President, I commend the work of the Minister for Police in the other place, my friend Minister Carbines, and the Police Commissioner Shane Patton for their partnership and commitment to getting this done. And I also commend the Minister for Health in the other place, Minister Thomas, for her work in this evidence-based health-led reform. Because people who are intoxicated in public need our support, not our punishment. The 2023-2024 budget providing $84.30 million for a health-based response to public intoxication, and this includes $78.7 million to deliver a dedicated public intoxication service response, important reforms, and it ensures that the right supports are in place when the legislation comes into effect in November. This government has delivered many criminal reforms, many which were delivered in accordance with the understanding that it is often more appropriate for emergency service workers to act in a health-based direction. And this government has listened to experts and acted on advice that will result in a more nuanced and effective role for our law enforcement, ensuring safety for a greater community. In 2021, the Andrews Labor government successfully passed the Summary Offences Amendment, Decriminalising of Public Drunkenness Act 2021, that sought to decriminalise public drunkenness in the state of Victoria. This was in recognition of the ongoing harm these laws were causing to vulnerable communities, including our First Nation communities. Public drunkenness reforms were one of the key recommendations that came out of the coronial inquest into the tragic death of Yorta Yorta, Wemba Wemba and Barra Barra woman Auntie Tanya Day. Day's death was another tragic reminder of the recommendations of the 1991 Royal Commission into Aboriginal deaths in custody. Both the coronial inquest and the Royal Commission called for the decriminalisation of public drunkenness. Acting on these recommendations and other expert advice, the then Andrews Labor government sought to construct a more health-orientated response to the public drunkenness. I also want to thank Ambulance Victoria for being an important partner on this, and although the development of a new model as we continue to work closely with them towards a health-led response. In the existing trials, we have seen positive evidence of the diversion into sobering and outreach services, which would otherwise have used ambulance services. In recognition that this would lead to safer results for both the public and the intoxicated individual, we must continue. These reforms do not simply decriminalise public drunkenness, but also seeks to introduce several service models to support the creation of a safer Victoria. The new health-led model is designed to see results that promote the safety of intoxicated individuals and those around them. Whilst our police here in Victoria are here to protect us and promote safety and are required to undergo training to respond to health issues, including intoxication, the creation of specialised terms can offer services specific to those suffering from intoxication in public. To assist in the implementation of these reforms, $88.3 million has been pledged to be spent over a 3-year period. This allocation of funds is to ensure that the service is supported in its early stages to build an effective and long-lasting addition to the face of Victoria's public service. The rollout of the model will prioritise service delivery to the Aboriginal community in recognition of how public intoxication laws have historically and continue to, in some cases, disproportionately affect First Victorians. This government has always been and will be committed to acknowledging that Aboriginal Victorians face unique challenges and injustices, and further committed to doing everything in its powers to right those wrongs. Whilst public intoxication is not limited to one group of people, Aboriginal Victorians are undeniably affected by the current ramifications of public intoxication. At this stage, intoxication law are not leading to the results that we want: a safer Victoria for everyone. Included services are as follows: an outreach program that will respond to intoxicated individuals needing assistance. Primarily, these outreach programs will assist for areas that might not otherwise have access to those services provided. Outreach programs will exist as an on-demand response to referrals. Depending on the needs of the intoxicated person, the outreach programs will be authorised to offer immediate assistance, organise private transportation for individuals, or, if the situation calls for it, transport individuals to a place in which they can safely recover from the effects of alcohol. Additionally, at peak times in metropolitan Melbourne, outreach programs will be authorised to identify and respond to cases of dangerous intoxications. They will have the same powers as during non-peak hours, including providing immediate assistance and transport. These outreach teams will ensure that we have a dedicated time ready and equipped to address cases of intoxicated peoples that potentially present harm to themselves and others. It also moves the handling of intoxicated individuals to a dedicated health-orientated team. This is not because we believe the police are ill-equipped, but simply an acknowledgement of the nature of intoxicated individuals and their general need for more dedicated assistance. These policies exist to encourage the safest and best outcomes for all Victorians. The service model will also introduce sobering centres in Metro Melbourne. These will act as important safe areas for intoxicated individuals where they can be monitored by healthcare professionals until they are fit to leave. These facilities will hold up to 20 beds for general population and a further 6 reserved for Aboriginal people. This is again recognition of our disproportionately effect of Aboriginal communities are affected by these changes, and ensuring that every step of the way we as a government can assist in harm minimisation for Aboriginal Victorians. This is just and correct course of action. Similarly, programs have been introduced in other states and territories with all high rates of success in preventing potentially harmful situations from occurring. This aspect of reforms will forever change Melbourne for the better, ensuring that Melburnians can have a good time and go and support their local life without having concerns about their safety and well-being. This service will also provide those suffering from alcohol and substance abuse issues with referrals to programs and such services if requested. Additionally, the service includes an opt-in follow-up if it is wanted or needed. This is included in all services as the Allan Labor government acknowledges that alcohol substance abuse episodes rarely occur in a vacuum, and that anyone suffering from these issues deserve to seek our treatment if they wish to. Unfortunately, seeking help cannot always be a straightforward process. Stigma and inaccessibility can prevent individuals accessing the essential supportive services they need to overcome a substance or alcohol abuse problem if they wish to address. Because of this, government programs can reach these people should do all that they can to direct those services that they need. Additionally, this rollout will include the creation of a centralised service for consultation from both those needing support from being intoxicated in public and staff providing service. This centralised service will be able to manage intake, referral and dispatch services, determining what the person's needs and then dispatching the appropriate service provider. It will also be centralised service for advice and information on outreach and sobering services. It will also act as a consultation service for staff on information about alcohol and other drugs to ensure staff are able to respond accordingly. The first sobering station has been confirmed already in Collingwood, situated close to the city in an area that sees a high rate of public drunkenness arrests. The centre is also close to public transport and St Vincent's Hospital. All of this will ensure that the Allan Labor government will create a safer Victoria with services that can offer an appropriate assistance to somebody intoxicated in public. Acting President, I want to wrap up by quoting the coroner's finding from the death of Miss Day. Miss Day was clearly preventable and had not been arrested and taken into custody, and there was no justification for the offence of public drunkenness to remain. Some 30 years after the Royal Commission into Aboriginals' death had recommendations since abolition. It is time we change the law, and we have, and we're proud of it. Thank you.